The mission at Defy Therapeutics is to enable access to air fluidized therapy beds for patients in their homes, the ones that suffer from the most severe chronic pressure ulcers. It's a product that has at times been readily available. Still in hospitals today, that product is provided. But the last few years here in the Midwest, there's been nobody that could provide air fluidized therapy for patients in their homes. All the while, insurance, if the patient qualifies, is willing to pay for it. The patient is going to be on microspheres, which is like little glass beads of sand. As the patient's laying on there, they're going to be receiving pressure relief, and how they do that is below the sand there's a diffuser board, which is kind of like an air hockey table. Millions of holes shooting up air that allow that sand to become fluidized, and when that fluidization happens, that's when the patient is receiving pressure relief, and they're sort of floating and levitating over so that they can provide wound healing. First and foremost, we've got to prove that what the patient is currently receiving is not working as far as wound therapy. And so it's really important that they're on an air mattress or some sort of Group 2 product currently, and that we've got wound measurements that just don't seem to be improving. So documentation is obviously very important to prove to insurance. We're sort of making a case that this patient should qualify for something that's much better. They also have to be wheelchair bound or bed bound, at least if the majority of the day. And so you certainly can't just have a wound and be walking around and be able to qualify for this. Most of it is just the wound measurements and the chart notes that the wound nurses are already sort of providing anyway. If we can take a snapshot of what the last 30 days have looked like and really sort of prove to insurance that they qualify, then we can take it from there, and then we bill the insurance and sort of handle all of that. And of course, we want to make that process very easy on these nurses because we know that they've got a lot of other patients to see. At Defy Therapeutics, we know that our mission is challenging and we need your help. We believe that we can overcome the odds of chronic wounds together.